That we, yeah. Yes, yes, okay, I'll discuss it. Okay, next slide. Lecithin radius. Fatty deposits that damage the kidney is identical to that which induces atherosclerosis. Could you imagine kidney damage, fatty damage, it's just plain atherosclerosis in the heart. And then what causes stroke, heart attack is the same as what is causing kidney damage. In this condition, the blood lecithin is decreased in proportion to the severity of the illness. That's from nutrition review. Cholesterol is extremely high, and milky blood serum caused by fatty substances is evident. Now, if you give them lecithin, lecithin rectifies the condition. Where do you get lecithin? Bone marrow, liver, brain, and big belly. Lecithin, that's the enzyme. Lecithin cholesterol acid transferase, LCAS. This is the key enzyme for the production of cholesterol. The presence of good bacteria in the colon. You know, brewer's yeast is part of what we call probiotics. You know probiotics? Pro-life bacteria. Like what we know is lactobacillus, bifidobacteria. But here, the yeast are also probiotics. Okay. Presence of good bacteria, including yeast in the colon and intestine, improves the overall digestive function. As probiotics grow and multiply, they consume more nitrogenous waste. So they will remove all nitrogenous waste, urea, creatinine, they will consume that. And which can effectively help maintain healthy kidney function. That's the latest urine. Honey contains antibiotic element. Okay, some infectious diseases can be treated by honey are peptic ulcer, dermatitis, cough and fever, lung, liver, and kidney disease. And you see that's from 2009 journal, infection journal, and you can see even tuberculosis can be controlled by honey and bromelain. Papaya. Okay, ito ay local product natin. We have papaya here, okay? Unripe papaya contains several antioxidants that can exert the following effects. Patients with type 2 diabetes are often advised to cut back on salt. So what's this stuff? So subjects, 638 patients with long-standing type 2 diabetes. Duration of the study is 10 years. Result, 175 patients died, mostly from heart disease. Each 100 millimole rise in 24-hour urine sodium was associated with a 28% decrease in all-cause mortality. After adjusting for baseline risk factors, conclusion, there is an inverse relationship between all-cause mortality and dietary salt intake. Diabetes scale 2011. That is loss of diabetes now. Okay, next. Concurrently, patients are also given food supplement, amino acids, probiotics, vitamin A, D, and C, complete B vitamins, and CBN capsules. Okay. Next slide. Large amount of choline, lecithin, vitamin A, and C can be given the minute kidney disease is diagnosed. So if you see kidney disease, okay, kailangan choline, lecithin, vitamin A. Okay, very important to reverse immediately. Giving vitamin C markedly increase urine production, even as effective as diuretics. Next slide. Vitamin D helps cells survive by decreasing their need for oxygen, preventing scarring, a severe problem in both kidney disease and kidney damage. So it will prevent scarring, that will block the tubules, lowering high blood pressure associated with kidney disease, and increases the flow of urine. Well, the most powerful is of course the alpha. But you can use the mix components. Next. Next slide. The kidney tubules are lined with mucous membrane. There, if too little vitamin A is given, they soon become clogged with dead cells. Thus, less urine is formed from the mental journal. So vitamin A is very important. As I said, a higher doses of it Coenzyme Q10 increases creatinine clearance and urine output in patients with chronic renal failure, thus lowering serum creatinine and BUN. The purpose of the coenzyme Q10 is to empower your liquidity to work and eliminate all useless. Remember, I told you coenzyme Q10 production can be blocked by histamine drugs. Next slide. Supplementation with thiamine, vitamin B1 of 1,000 milligrams per 3 times a day may help fight diabetic kidney disease from Journal Diabetologica, 2008. Vitamin B1 could reverse early-stage kidney disease in diabetic patients, Diabetologica, Journal, 2008. Giving pyridoxine can reduce the damage to kidneys by sharp crystals of oxalic acid. Oxalic acid can be removed by magnesium and B6 or pyridoxine. Folic acid and vitamin B complex effectively lowers plasma homocysteine levels, lowers serum C-reactive protein, increase albumin levels in stable hemodialysis settings. That is, it protects the patient. Vitamin D therapy holds promise for improving health outcomes, improving glucose metabolism in patients with chronic kidney disease. Next slide. Food supplements, oral injection of probiotics resulted to decrease in BUN levels, decrease in creatinine levels, decrease uric acid level. Almost all subjects expressed a perceived substantial overall improvement. Okay. Adverse therapy, 2010. Food supplements. In acute renal failure, the following conditions are present. But you see in acute renal failure, marked decrease in ascorbic acid, marked decrease in carotenoids, antioxidant, marked decrease in tocopherols, vitamin E, marked decrease in selenium, marked decrease in glutathione. So what do you do? In addition, there is also profound increase in malondehyde. That is the end product of lipid peroxidation, especially for those who are drinking. And that is a superpower oxidizing agent. This underlines the importance of supplementation of antioxidant micronutrients for patients with acute renal failure. And acetylcysteine can prevent serious kidney damage that can be caused by the iodine-containing dyes that doctors use to enhance the quality of CT scans and angiogram. That is from the University of Michigan Health System 2008. Okay, that's a precursor of glutathione. Antioxidant therapy with acetylcysteine significantly reduced cardiovascular events among hemodialysis patients. That is from Sessions on Causes of High Blood Pressure, September 2002. Avoidance of the following products. Okay? Unfermented soy products are dangerous. Soy gluten food should be strictly avoided by anyone with failing kidneys. That is the advice by the American Dietary Association 2007. Soy foods were found to be high in oxalates and likely to contribute to kidney stones. Okay? Journal of Agriculture, Food Chemistry 2001. If it is fermented, it's okay. But if it is unfermented, it's dangerous. No, it's unfermented. Dangerous. If you give soy milk to a baby, it's just like giving birth control pills every day. Unfermented soy products. People who consume 93.5 grams of soy products and address chronically elevated blood sugar brought about by consumption of sugar refined carbohydrates in pyramid diet, commonly referred to as hyperglycemia, can damage the kidneys. That is 2000, endocrine review, year 2000. Trans fats, corn oil, canola oil, soybean oil, and polyunsaturated oils can damage cellular membrane, interfere with cellular respiration, inhibit glucose transport, set in motion consequences that corrode the arteries, damage eyesight, leads to blindness, devastate the kidneys, destroy our venous system, directly cause large area of similar systemic problems. That's from the Oiling of America by Thomas. Now here's a patient of mine from Bacolod City. Okay. His age was 66 years old. Okay. He was He underwent angioplasty at the Philippine Heart Center August 2005. Remember the night that was kidney failure. 2 months after he had kidney failure, October 2005. From October 2005 up to March 2006, he was on dialysis. When I saw him 2006, his creatinine was 690 over LBS 247, diabetic, right? Okay. And swollen, difficulty walking due to swollen, dark skin feet, wound on left toe, debrided dark skin, and he was under medication, Horbas, including donor, dental, blood syringes. Another the patient when he came to me March 2, 2006. Patient was given the rapid cerebral advised to drink whey milk, 2 to 3 times daily, 8 plenty of eggs, fresh fruits and vegetables, and given food supplement. After a month, you could see the difference. Just for a month, he was already walking. Can now walk with ease. His creatinine went down to 344, blood sugar was 96, okay. Blood pressure was 160 over 80 without dialysis. Another month after, this is the picture, okay. Creatinine is already 274. Up to 2000 this year, the latest is 203 without dialysis. By the way, I have a patient here. He's now already 83 to 84 years old. He was at the Kidney Institute. His creatinine rose to about 9.
Tapos na-dialysis po siya ng isang beses lang. And then, nung gumising po siya, nagtula, sabi niya, galing daw siya sa isang malayong lugar. Parang wala lang, sabi niya. Tapos tayo, wala naman akong sakit. Nagulat mo yung mga doctors doon. Nagtaka sila, sabi niya, ano to, nagbuhay na niya. Tapos yun, pagkabangon ni tatay, sinabi niya, hindi na kami wala akong sakit. Hindi na kami.
Well, na magitik ng katigan na doktor na pagaling siya maraming sakit. At ako isa at nagaling ng doktor. Ang sinabi ng anak ko ay yun, na ako'y nakupay doon sa Philippine Hospital ay kahit na yung linggo nakupay doon. Pero para ganyan pa kumagaling. Pero nung araw na yun, pag-agara ko'y tulong, kahit gusto, kahit ka ko, wala, hindi pa rin makatulog na ito. Hindi pa hindi tulog ko. So, sabi pa mo tayo mga okay. Ngayon, nung parang na yun, parang nakatulog ako ng 2 oras. Dahil nung nag-ilit ako na sa paglabuhay na ito. Nakikita ko yung lugar ko na para magwanan. Pero sabi ko naman, ano gabay ko? Ito wala naman ako nakikat tao, wala nakikat bahay, wala naman mga building, wala. Puro lang, iwanan sa lugar na yun. So, sabi ko na pa yung kapit. Siguro bumalik ka niya lang doon sa lugar na pinagalingan ko. At maraming kapag magpaturo sa mga kapwa mo na nangyayari. So, yung yaya, mabalik ako. At mabalik ko, nagising na rin ako doon sa tegaan ko. Kaya nung pagkagising ko, parang nakita pa ako na lumakas aking nalawa. At ako ay nagluto ka na nauhaw. Ngayon, sabi ko sa anak ko, manipatay sa ako. Sabi ko, ilay ako ng tubig sa maso para ma-alaro ako. Eh, ayaw naman ng anak ko dahil ayaw na doktor nung mabigyan ng maraming tubig pala nakalawang tubig. Nalilita siya na mabigyan ng tubig. Sabi ko, sinabalik ako yung mas kulawin. Ganon, parang akong imalaan ka. Wala na lang sakit ko. Wala na tayo. Wala na sakit. Tayo na ako. Sabi ko, tayo doktor na ako. Wala na tayo. Sabi ko, sabi ng doktor daw, kung ginaw. Pag-pagod mo na mga 4 na oras bago kami-uli. So, na 4 hours, isla na para global organization pa rin natin na sitwasyon mo pala ngayon. Ngayon, pagpapasalamat sa Diyos at kay Dr. Rodel, napagaya ito, pinagaling na, dito ko na ngayon ay nag-iipon na. Kay Dr. Rodel Navarro, aking kaibigan na Dr. Salamat sa nakuhay. Pagpapalay tayo natin ng Bigyan natin ang mga Dr. Kaya makuha na ito at makatulong sa aking pamumuhay. Maraming salamat.
Many are asking what is wrong with cellular balancing. Should we have an explanation? We still have time. Okay. A little explanation, but I can present this next year. Just to give you a brief, in our body we have stem cells. Okay, we have what we call the embryonic stem cells, which are taken from a 5-day embryo after the mating. Okay, the sperm and the ovum, the egg meets, and the cell is an embryo. 5-day embryo. There, in a 5-day embryo, all cells are what we call pluripotential. So every cell there can become heart, liver, kidney, or anything under the sun. Pluripotential. But I'm not talking about stem cell, embryonic stem cell. Other cell. In the body we have adult stem cells. In the brain we have adult stem cells that can regenerate the brain. When I studied medicine, we never knew that we can regenerate the brain. But now we can do it. We just found out there are stem cells in the brain that can regenerate the brain. Like what happened to him. He was comatose and he was suddenly okay. But I know it's a miracle of the Lord. Maybe the Lord just backed up the research. Because so many comatose patients woke up with my system. Hindi lang siya nakakadami. Okay. In the brain, there are these stem cells, when they mature, they become neurons. So they conduct, electrical conduction. Or they can become astrocytes or oligodendrocytes. They're not involved in conductions. In the skin, we have stem cells. If you can regenerate the stem cell, the skin of senior citizens will become junior citizens. Okay. In the gastrointestinal tract with the stem cells, if we can enhance them, it could repair full cell and everything. Crohn's disease, and many patients with Crohn's disease who are okay already. Even those who have been abroad, they came to me with Crohn's disease and they got within 1 month. And in the liver, we can regenerate the liver. You could see some of my patients will come here for liver transplant or UPPGs, but with the stem cell enhancing RCD there well. So here's about stem cells. When we are 2 years old, the peak production of stem cells is at 2 years old. When you reach 2 years old, it begins to decline. So in the body, there are about 16 million stem cells moving around. The bone marrow is the source of stem cells. The bone marrow contains hematopoietic stem cells, which converts into red blood cell or oxygen transport, white blood cell, cellular immunity to control bacteria and virus, and platelets to prevent bleeding or to prevent dengue. Okay. But the bone marrow has also what we call another form of stem cells. One is hematopoietic, okay, and the other one will convert non-hematopoietic stem cells, okay, which will convert into bones, cartilage, connective tissue, fats, okay. So this you get from the bone marrow. So the bone marrow can differentiate into these things, but in special circumstances, that's differentiation. In special circumstances, the bone marrow can become stem cells that will mature to repair spinal cord. That's why I have a lot of patients with spinal cord problems who could not walk, and now they're walking. I had a patient from Las Vegas. She was there for 15 years. She could hardly walk, damaged spinal cord. She said, I will go to the Philippines. Then the doctors told them, you mean to say you're going to go to the Philippines? You're already in the United States? The Filipinos, they come here, but you are going there. That's the reverse. Then the patient came to me. 15 years she could hardly walk. The next morning she was walking. And that's why many people from the United States in a year because of that patient. Okay? So that is the effect of stem cell. Now, peak production when you are 2 years old. After 2 years old, it begins to fall decline. When you reach age 16, senior citizen, your stem cell becomes SCS. Stem cell. It's called stem cell because it gives when it matures from this young cell, something good comes out. It matures. Well, remember, stem cells have no function. They have no function. They're not baby. But when they mature, they become liver cell, muscle cell, heart cells, brain cells, spinal cord cells. So everything can be repaired. Okay. So that can be done by RCD, as stem cell enhancing.
If it is then put in the frozen, will it be effective as it is raw? And number 2 question, how much egg white or egg you will swallow raw per day? Third question, to become a third stage of glomerular filtration rate to be increased into stage 2, how much of the above we should take in order that it will improve rather than going to stage 4?
It's a normal intake. For those adults, 4 eggs per day. For those who are sick already, 6 eggs a day. For those who are serious with cancer, I give up to 10 eggs a day. It could be raw, it could be raw. When you see patient of mine with cancer on Thursday, predicted to die July last year, but he's very much alive. Stage 4 liver cancer with liver problem. I'll talk about liver on Thursday. Okay, so cancer patients, I give very high dosage of egg, 6 to 10 if they can take it. Don't worry about egg. No? There was a study in England whereby a person began eating eggs at the age of 58, 25 eggs a day. At the age of 58. And after 30 years, he was already 88. That shows to you he survived long already. And he was still eating 25 eggs a day. That was published in British Medical Journal. So they tested his cholesterol, it was normal. But the patient is very, very ill. Look at this patient of mine. Just arisen from death. Buhay na buhay. Nakita nyo? Malakas pa with power. 84, asawa pa ng teenager, at nagkanak pa ng 3. Okay? Fantastic. So eggs do not kill. I will lecture on that tomorrow afternoon about the bitter. Well, the best is native eggs, but if there is none, you can still use the white egg one. I use in my clinic for cancer patient only native egg.
What radiant level should we reach in order to have a stage 3 filtration rate? What is the normal value of the creatinine so that we will reach a stage 2, from stage 3 to stage 2 filtration rate?
Once you know how can we improve. Example, you are in stage 5, how can you go to stage 4 to stage 3? You follow what the system is doing with the use of RCB and functional food and all the supplemental energy, and that helps a lot the patients. And that patient and the other patient that I showed, he was already on stage 5, ESRD, but now his creatinine was about 700, it's now 200. Okay, and he's perfectly normal, so that means he is already on stage 1, but he's already in a good stage 1. Regarding Mr. Alusagay, he had no dialysis since 2006, after the treated until now, and he's still very active in the church. He goes to the church and lives in the church. So until now, can you see an 84 years old talking like that, who was formerly comatose? So that means it will improve. The most important, we follow the diet. Frozen liver. If the liver is frozen, that's still okay. The milk that I give is frozen milk. Raw certified frozen milk. So it's still okay. Nothing is harm. But if it is pasteurized, some of the enzymes are destroyed at 67 degrees centigrade. So if you like all the enzymes of the liver, you have to eat a little bit raw. I give my patients twice a day raw certified milk pasteurized. Because the real unpasteurized milk has a big what you call advantage on antibodies. some of the antibodies can be affected by heating because whey milk is heated a little during the reduction, but it's not pasteurization process. But with the heating, it will affect some of the enzymes. So if you like to remove the enzymes and the antibodies in the milk, you give them either breast milk. Breast milk is the best for babies and even for us, but we cannot buy breast milk here. So only on our breast milk. It is the RCB is it is a powder, and you have to dissolve that. And then it's given to the patient. Hindi naman, I had a lecture here last year about rapid cell balancing, and maybe you can get that in my clinic. The title is Rapid Cell Balancing. I get that lecture here last year. Last year I gave 2 lectures here, functional food and rapid cell balancing. So if you'd like to know the details about RCB, that's in the lecture.
Navarro, I have a question.
Yes.
Normally, when the kidney is compromised or shrunken, or if it is not exactly, but if the filtration rate has gone to a certain level, then the creatinine goes up. But first of all, we usually observe that proteinuria or hematuria usually started, and then later on, when it has come to a certain extent, then creatinine will go up. That's usually the situation. When we say the creatinine has gone up, usually we recognize that the kidney is compromised. Some of them has already shrunken. So we can see that usually that when creatinine has gone up to 6,000, 1,000 or 800, mostly we see that it is the kidney has already shrunken. But it blows the mind of people, of nephrologists, that we were able to lower it down, and then the kidney function, the glomerular rate goes up. The question, the usually thing that happens is, in the case of your experience, the shrunken kidney is restored back to normal size.
And according to the study, without stem cells, there is no repair. That means if you cannot enhance the stem cell, you cannot repair anything in the body. You will find a patient of mine with liver failure, total liver failure, that needs liver transplant. The UPPDA says no more hope for him. And that was in 2007. I treated him. In 2 months, he was back to normal already. I have a patient with cancer. He has a lung cancer that is 71 years. 6 months under my Then he came to me. Under my care, his weight from 71 kilos became 88 kilos higher than before, and now he's back to normal. Okay? After 6 months of management. That means stem cell, that if it can be enhanced, it can heal anything in the body. The key there is you must enhance the stem cell. Now, how effective is the diet? Example, this published in the British Journal of Nutrition, here, American Clinical Nutrition Journal. Young animals, okay? Young animals were given complete foods, fats, protein, carbohydrates. They remove only one ingredient, choline. Choline, C-H-O-L-I-N-E. On the 7th day, all animals are dead. That's to see you how important is choline. On the 7th day, all animals are dead, and when they examine the animals, the cause of death is simply glomerular disease. The animal developed glomerulonephritis, and it clogged up the system that death occurred, and that's already stage 5, right? So they repeated the experiment, again without choline. On the 6th day, the animals were dying. They gave the animals 1,000 milligram choline, and not one of the experimental animals died. So choline prevented death due to kidney failure. Where do you get choline? You get that from 4 eggs a day. You get that from the egg yolk. You get that from liver. You get that from brain. The brain is mostly choline and cholesterol. You get that from bone marrow. So we could not find good improvement with kidney patients because they are deprived of choline because of the scare regarding cholesterol. But I tell you, things have changed already, and that will be my topic tomorrow. That it's no longer, cholesterol is no longer bad. So,
Question. Using your method, what is the success rate? Like out of 10 patients with kidney dialysis, what is the percentage of success?
I would say I'm getting about 70%. Okay. About 70%. In other conditions, where the patients have been comatose due to stroke, a very high percentage of recovery. I would say all the other conditions are easy to manage, and I would say at this point in time, there are two things just to tackle: kidney failure and cancer. But my results are getting very, very fast. Maybe I could show you something of this tomorrow.
Doctor, if a patient has already been on dialysis, say for a year, or 2 years, 3 years, when you give your treatment, do they stop the dialysis right away, or do they do it simultaneously and they face up the dialysis?
I never tell my patient to stop the dialysis. I just treat them. But the patient, the first one that I showed, he just stopped it because he felt better. But his creatinine went down up to 200, but it never went down below 200. This patient of mine, the one who talked Marina, he has never had dialysis since he left the hospital. But you see, he's very healthy. Alright? So, I never tell my patient to stop dialysis. I tell them, go ahead. If they feel better, they stop it. Then I have many patients who stop the dialysis when they are back to work already. But never did I tell them to stop it.
Sa patient report of Dr. Navarro, files of Dr. Navarro, because of Dr. Bulalo, Dok, ilang bang kilo ang kailangan na bone marrow kakainin para masabi mo? Kasi, since na nakilala ko kayo, siguro 20 kilos a week ako. Sa 2 nights ago lang, nagtuto kami 35 kilos bulalo. Kasi my family last bulalo. Pero for me alone, I eat, kasi I believe on Dr. Navarro, I eat bulalo mga 20 kilos a week. And then 8 eggs a day. But it's native or duck eggs. Kasi sabi niya kasi fountain of youth. So I tried, but tumaba ako. So, ano ba talaga? Pero what is good, wala akong cholesterol, wala akong hypertension, mataba ako, but wala akong nun. So, at tanong ko lang, gaano ba talaga ang limit nun? Kasi I love bulalo.
Maybe you have to check your carbohydrate intake. Because 90% of the carbohydrate converts into fats in the body. Only 10% is used as energy. So, if you are not eating, let's say, your diet is high in carbo, that will convert into fats, 90% of that. That's why you're gaining weight. Remove your carbohydrates, or you have to eat whole wheat bread. Maybe only for you, about 1 slice 3 times a day. The cheese that I use tatak pato. So for the eggs, I use tatak pato rin. For the cheese, queso de bola, tatak pato.
So kung wala talagang fertilized, just don't eat the eggs.
No, you still have to eat the eggs as a source of protein and other things. But remember, there's a difference between free range. First, if you look at the chromosome number, okay, it's like this. The chromosome number of mated egg is 46. 23 from the male, 22 from the female, total 46. From single parent eggs, the chromosome number is only 23. That's abnormal. Cancer has an abnormal number of chromosomes. So for all my cancer patients, I don't allow them to eat fertilized egg, extra virgin egg. I tell them it's disease, but for non-cancer, you can still eat.
No, pwede po ba yung itlog ng pulo? Kasi yung ano ko 3 years old, very fun po siyang kumain ng itlog. itlog. Kaya lang, hindi niya naubos natin sa mga. So, I gave him itlog ng pugo. Tapos sa sa kumain ng pugo.
Oh, maliit na naman yan. No problem, yeah. Imagine them, they could eat 6 to 10 eggs a day each. And they are the brightest in the school, they are the number one in the school, and they are the healthiest and the strongest in the school.
I guess it's time for lunch, but it all depends on you. If you want to continue asking questions, and Dr. Navarro wants to continue answering. So you can ask them all tomorrow, so you will all come to the seminar tomorrow. Okay, no more questions. So we'd like to thank Dr. Navarro for